me through this one here.
All right. Which of the following is the most likely cause of her symptoms? 45-year-old woman comes to clinic complaining difficulty swallowing and a hoarse voice for the last month. She also reports feeling full quickly after eating and having persistent sore throat. On examination, her uvula deviates to the left, gag reflex is absent on the right side. Which of the following is most likely cause of her symptoms? Okay, so she's feeling full, difficulty swallowing, hoarse voice. So it has to do something maybe with esophagus, stomach. Thinking maybe no GERD. She would have that wouldn't really affect her voice. Um, maybe like esophagitis, like inflammation of her esophagus. Um, let's see, Bell's palsy, but then like there's the gag reflex and then the uvula, Bell's palsy, laryngeal nerve injury, vagus nerve lesion, hypoglossal nerve lesion. Okay, so this is a nerve issue. So the nerve, she's having like what's it called? Muscles aren't working in her esophagus to like peristalsis not working to help her swallow. That's also going to be causing the absent gag reflex and then the deviation of uvula there. So I want to say not hypoglossal, that's my tongue. Glossopharyngeal. No, I want to say I'm thinking vagus nerve lesion.
Okay. Do you want to keep it or change it? That's your gut answer choice here.
Laryngeal. Okay, it's not Bell's palsy. That's not Xing that out. Laryngeal nerve. I don't think they'll use a hypoglossal or glossopharyngeal. I'm never confident between hypoglossal or glossopharyngeal, but I'm still thinking Vegas.
Okay, final answer.
Yeah, let's go with that.
Yeah, perfect. So let's work those together. So when I'm reading this question, I'm seeing that, chief complaint is difficulty swallowing and hoarse voice. Okay, very specific, right? Also, she has issues with feeling full, sore throat, uvula is deviated to the left, is absent on the right. So I know that probably dealing with nerve issue. Okay, and a very, very widespread nerve. A nerve has to cover all these things, right? So swallowing voice. So her larynx, right? Her esophagus, right? Her stomach, right? Her uvula and her soft palate and her gag, right? Is her pharynx, right? So it needs to cover all this. Bell's palsy, what nerve is this?
Bell's palsy is facial.
Good. Facial nerve, which is cranial nerve 7. Okay.
Mm-hmm.
Laryngeal nerve injury. Okay. So what is laryngeal nerve injury? What is that kind of? Do you know what a branch of this comes off of?
Laryngeal. I don't.
So this actually comes off your vagus. Okay, so like your
Okay.
recurrent laryngeal or your superior laryngeal nerve, right? So that will only deal with mainly her voice, right? And sometimes even a gag, but it should not mess with her uvula. Okay, so that can't be right. Okay, because that's just too specific, right? That will give hoarse voice, but not kind of the swallow stuff. Hypoglossal is tongue, so no tongue issues, right? Tongue would be deviated to the side that it's messed up on, right?
Mm-hmm.
Glossopharyngeal can deal with some gag, right? But not going to give you hoarseness of voice. So the only thing that gives you all of this is your vagus. And remember, your vagus goes all the way down, right? It gives you your parasympathetics to your gut too. So going to deal with hoarse, gag, uvula, also all the way down. Okay. So that's going to be your best. All right. Questions about that? Does that make sense? Kind of how you're thinking about it?
Yeah, so I just want to read because I always it's hard for me to differentiate between hypoglossal and glossal pharyngeal. I'm just trying to read this through. So this is cranial nerve 12 versus 9. Lesion weakness and atrophy toward side of lesion. And then glossopharyngeal is 9. Cause impaired taste sensation and decreased salivation, difficulty swallowing. So nine's only dealing with taste and
So posterior's taste, the posterior 1/3 of the tongue. It can also cause uvula deviation too. Okay. But it's really not going to cause hoarseness of voice. Hoarseness of voice is off of 10 recurrent laryngeal, which will give you kind of the motor of your larynx. Okay. And then that's going to be 9, right? And then 12, right, is just the tongue, right? 12 is going to be the tongue. 9 is going to be kind of what we talked about, right? 10, like I said, is going to deal with almost everything in the body.
Yeah.
Um, and then Bell's palsy, like you said, is cranial nerve 7, which is facial. So
Okay.
okay.
Cool. Got it.